We're joined now by Kim LaBree. She's an assistant administrator of patient services. And Kim, you have been kind enough to answer some questions that we had solicited from some of our listeners on our social media when we first announced that we were going to be here. So I want to start by asking you, first welcoming you and thanking you for being here with us.
Thank you. It's a privilege.
So first, question number one, does Northeast Florida have different cancer trends from the rest of the country?
Yes. So we are seeing some different cancer trends in Northeast Florida. What we're seeing in this area is notably higher lung cancer rates in the Duval County area and high overall leukemia rates. We also see a prevalence of prostate cancer and, feel this is largely driven by our aging population in Northeast Florida. We see a number of skin cancers, and that prevalence has also increased. And because of these trends, we're continually strengthening our support services and infrastructure here at Baptist MD Anderson. This allows us to care for patients more innovatively, as well as provide that long-term care support that we're seeing as these aging populations and these cancer patients kind of make their journey from their initial cancer diagnosis through their long-term treatments.
Another question from a listener is, are there early symptoms that indicate cancer?
So not every cancer has early warning signs, but what we do recommend is ensuring that everybody has a primary care physician that they see at least annually. So many people get caught up in their daily lives and they kind of put their own health to the side, but being able to see their physician on a routine basis will make sure that they're sharing any and every symptom or change that they've noticed with their own body. Some potential signs of cancer could include some unexplained weight loss, persistent fatigue, having unusual lumps and bumps, having a persistent cough, hoarseness, any changes to the skin. But really, among those things, it's what's new, what's different, what hasn't been there before that people should be alert to. And because so many of these symptoms can be caused by less serious conditions, that's really the importance of seeing your physician. So you and your physician can look deeper into these, evaluate what's going on, and make sure there's no cause for worry.
Right, because so many people see these little things and say, oh, it's just a little thing, and it could be anything. Yep. So it's always best to ask your doctor. And we do want to remind our listeners, if you have questions after our broadcast, you can always go to today's show notes to hear these interviews again. But if you still have more questions, reach out to us and we will get you in touch with the proper folks at Baptist MD Anderson. So another listener question, how effective are blood tests at detecting cancer?
Yeah, so traditional blood tests that you'll have done with your primary care physician during any routine annual exam can sometimes suggest that something might be wrong, but they can't diagnose cancer. So that's why keeping up with your regular screenings are so important. They can detect anything early, even if you don't have symptoms. And so the most important piece when dealing with any type of cancer is early detection. Knowing your body, advocating for your health, and sharing these concerns with your healthcare provider will really help ensure that we have earlier detection and better rates of survival.
So one of the things that I know, especially in my age group, I hear a lot of people say, oh my gosh, that person was just diagnosed with stage 3, stage 4 cancer because they missed the 1 and 2 because they waited so long. So how do most people find out that they have cancer?
So most people find out they have cancer through a variety of factors. This can be listening to your body and discussing persistent abnormal symptoms, but also through the screening tests that we all know we're supposed to have. So regular checkups, regular physical exams with your primary care provider will help support that early detection, as you said. And the earlier we know about something, the more we can look into it and hit things right on target. So we know, again, lives are busy. We've all got something that we're going to do, and we're going to put our health to the wayside there. But for those of you that need help looking for a primary care provider, again, that being the most crucial thing with early detection, we're available here for you at Baptist Health as well by calling 202-FOR-YOU. And again, those are the most wonderful things that you can do for your own health by getting to someone early and sharing those symptoms with somebody to be looked at.
Give us that number again, 202?
202-FOR-YOU.
202-FOR-YOU? I didn't know that.
Yeah. Super simple. Why do you love working at Baptist MD Anderson?
I think we're giving back to our mission, right? We're treating the patients at home where they need to be treated. We're bringing in the world-class cancer care from MD Anderson, combining it with what Baptist Health has to offer our community. And it's the compassion that we provide for these patients going through such a hard journey. And any ability to make that better is really, I think, what moves us.
Not having to travel is so important. And we're blessed to have it here in the community that you don't have to travel very far. It means so much.
Yeah, it is.
I think it's great. Jacksonville's Morning News, live on location at Baptist MD Anderson Cancer Center. Thank you, Kim. Appreciate it. Very
Thank
nice
you
to
all
meet
for
you this
having me.
morning, and thanks for answering so many of these questions. And again, the phone number one more time if anyone does need to reach out to you all.
202-4U, Y-O-U,
904.
904.
In Duval. Jacksonville's Morning News continues at 9:16.